Everything you need to know about diabetes. Diabetes mellitus is a metabolic disease that causes high blood sugar. Your body either doesn't make enough insulin or can't effectively use the insulin it makes. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. If this malfunctions, you may have diabetes. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. But educating yourself about diabetes and taking steps to prevent or manage it can help you protect your health. Types of diabetes. There are a few different types of diabetes. Type 1. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas, where insulin is made. It's unclear what causes this attack. Type 2. Type 2 diabetes occurs when your body becomes resistant to insulin and sugar builds up in your blood. It's the most common type. About 90% to 95% of people living with diabetes have type 2. Type 1.5. Type 1.5 diabetes is also known as latent autoimmune diabetes in adults. It occurs during adulthood and sets in gradually like type 2 diabetes. It is an autoimmune disease that cannot be treated by diet or lifestyle. Gestational diabetes. Gestational diabetes is high blood sugar during pregnancy. Insulin-blocking hormones produced by the placenta cause this type of diabetes. A rare condition called diabetes insipidus is not related to diabetes mellitus, although it has a similar name. It's a different condition in which your kidneys remove too much fluid from your body. Each type of diabetes has unique symptoms, causes, and treatments. Pre-diabetes. Pre-diabetes is a term that's used when your blood sugar is higher than expected, but it's not high enough for a diagnosis of type 2 diabetes. It occurs when the cells in your body don't respond to insulin the way they should. This can lead to type 2 diabetes down the road. Experts suggest that more than 1 in 3 Indians have pre-diabetes, but over 80% of people with pre-diabetes don't even know it. Symptoms of diabetes. Diabetes symptoms are caused by rising blood sugar. General symptoms. The symptoms of type 1, type 2, and type 1.5 are the same, but they occur in a shorter period than types 2 and 1.5. In type 2, the onset tends to be slower. Tingling nerves and slow healing sores are more common in type 2. Left untreated, type 1, in particular, can lead to diabetic ketoacidosis. This is when there is a dangerous level of ketones in the body. It's less common in other types of diabetes, but still possible. The general symptoms of diabetes include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal. Most people who develop gestational diabetes don't have any symptoms. Healthcare professionals often detect the condition during a routine blood sugar test or oral glucose tolerance test, which is usually performed between the 24th and 28th weeks of pregnancy. In rare cases, a person with gestational diabetes will also experience increased thirst or urination. The bottom line. Diabetes symptoms can be so mild that they are hard to spot at first. Learn which signs should prompt a trip to the doctor. Causes of diabetes. Different causes are associated with each type of diabetes. In type 1 diabetes, doctors don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Genes may play a role in some people. It's also possible that a virus sets off an immune system attack. In type 2 diabetes, type 2 diabetes stems from a combination of genetics and lifestyle factors. Having overweight or obese increases your risk, too. Carrying extra weight, especially in your belly, makes your cells more resistant to the effects of insulin on your blood sugar. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. In type 1.5 diabetes, type 1.5 is an autoimmune condition that occurs when the pancreas is attacked by your own antibodies. As in type 1, it may be genetic, but more research is needed. In gestational diabetes occurs as the result of hormonal changes during pregnancy. The placenta produces hormones that make a pregnant person's cells less sensitive to the effects of insulin. This can cause high blood sugar during pregnancy. People who are overweight when they get pregnant or who gain too much weight during pregnancy are more likely to get gestational diabetes. The bottom line: both genes and environmental factors play a role in triggering diabetes. Diabetes risk factors. Certain factors increase your risk for diabetes. In type 1 diabetes, you're more likely to get type 1 diabetes if you're a child or teenager, you have a parent or sibling with the condition, or you carry certain genes that are linked to the disease. In type 2 diabetes, your risk for type 2 diabetes increases if you are overweight, are age 45 or older, have a parent or sibling with the condition, aren't physically active, have had gestational diabetes, have pre-diabetes, have high blood pressure, high cholesterol, or high triglycerides. Type 2 diabetes also disproportionately affects certain racial and ethnic populations. In type 1.5 diabetes, it's found in adults over 30 and is often mistaken for type 2, but people with this condition are not necessarily overweight, and oral medications and lifestyle changes have no effect. In gestational diabetes, your risk for gestational diabetes increases if you are overweight, are over age 25, had gestational diabetes during a past pregnancy, have given birth to a baby weighing more than 9 pounds, have a family history of type 2 diabetes, have polycystic ovary syndrome, PCOS. The bottom line: your family history, environment, and pre-existing medical conditions can all affect your odds of developing diabetes. Diabetes complications. High blood sugar damages organs and tissues throughout your body. The higher your blood sugar is and the longer you live with it, the greater your risk for complications. Complications associated with diabetes include heart disease, heart attack, and stroke, neuropathy, nephropathy, retinopathy and vision loss, hearing loss, foot damage, such as infections and sores that don't heal, skin conditions, such as bacterial and fungal infections, depression, dementia, gestational diabetes. Unmanaged gestational diabetes can lead to problems that affect both the mother and baby. Complications affecting the baby can include premature birth, higher than typical weight at birth, increased risk for type 2 diabetes later in life, low blood sugar, jaundice, stillbirth. A pregnant person with gestational diabetes can develop complications such as high blood pressure, preeclampsia, or type 2 diabetes. You may also require cesarean delivery, commonly referred to as a C-section. The risk of gestational diabetes in future pregnancies also increases. The bottom line: diabetes can lead to serious medical complications, but you can manage the condition with medications and lifestyle changes. Diabetes and diet. Healthy eating is a central part of managing diabetes. In some cases, changing your diet may be enough to manage the disease. Types 1 and 1.5 diabetes. Your blood sugar level rises or falls based on the types of foods you eat. Starchy or sugary foods make blood sugar levels rise rapidly. Protein and fat cause more gradual increases. Your medical team may recommend that you limit the amount of carbohydrates you eat each day. You'll also need to balance your carb intake with your insulin doses. Counting carbs helps to balance the carb intake with the insulin doses. Type 2 diabetes. Eating the right types of foods can both manage your blood sugar and help you lose any excess weight. Carb counting is an important part of eating for type 2 diabetes. A dietitian can help you figure out how many grams of carbohydrates to eat at each meal. In order to keep your blood sugar levels steady, try to eat small meals throughout the day. Emphasize healthy foods such as fruits, vegetables, whole grains, lean proteins such as poultry and fish, healthy fats such as olive oil and nuts. Certain other foods can hurt efforts to manage your blood sugar. Gestational diabetes. Eating a well-balanced diet is important for both you and your baby during these 9 months. Making the right food choices can also help you avoid diabetes medications. Watch your portion sizes and limit sugary or salty foods. Although you need some sugar to feed your growing baby, you should avoid eating too much. Check out other do's and don'ts for healthy eating with gestational diabetes. The bottom line. Work with a registered dietitian if you have access to one. They can help you design an individualized diabetes meal plan. Getting the right balance of protein, fat, and carbs can help you manage your blood sugar. Diabetes and exercise. Along with diet and treatment, exercise plays an essential role in diabetes management. This is true for all types of diabetes. Staying active helps your cells react to insulin more effectively and lower your blood sugar levels. Exercising regularly can also help you reach and maintain a healthy weight. Reduce your risk of diabetes-related health complications. Boost mood. Get better sleep. Improve memory. If you have type 1 or type 2 diabetes, general guidance is to aim for at least 150 minutes of moderate intensity exercise each week. There are currently no separate exercise guidelines for people who have gestational diabetes. But if you're pregnant, start out slowly and gradually increase your activity level over time to avoid overdoing it. Diabetes-friendly exercises include walking, swimming, dancing, cycling. Talk with your doctor about safe ways to incorporate activity into your diabetes management plan. You may need to follow special precautions, like checking your blood sugar before and after working out and making sure to stay hydrated. Consider working with a personal trainer or exercise physiologist who has experience working with people who have diabetes. They can help you develop a personalized workout plan tailored to your needs. Diabetes diagnosis. Anyone who has symptoms of diabetes or is at risk for the condition should be tested. People are routinely tested for gestational diabetes during their second trimester or third trimester of pregnancy. Doctors use these blood tests to diagnose pre-diabetes and diabetes. The fasting plasma glucose (FPG) test measures your blood sugar after you have fasted for 8 hours. The HbA1c test provides a snapshot of your blood sugar levels over the previous 3 months. A 75-gram oral glucose tolerance test is also used. This checks the blood glucose 2 hours after ingesting a sugary drink containing 75 grams of carbs. How to diagnose gestational diabetes? To diagnose gestational diabetes, your doctor will test your blood sugar levels between the 24th week and 28th week of pregnancy. There are 2 types of tests. Glucose challenge test. During a glucose challenge test, Your blood sugar is checked an hour after you drink sugary liquid. If your results are standard, no more testing is done. If blood sugar levels are high, you'll need to undergo a glucose tolerance test. Glucose tolerance test. During a glucose tolerance test, your blood sugar is checked after you fast overnight. Then you're given a sugary drink and your blood sugar is retested after 1 hour and again after 2 hours. Gestational diabetes is diagnosed if any of these 3 readings come back noting high blood sugar. The earlier you are diagnosed with diabetes, the sooner you can start treatment. Find out whether you should get tested and get more information on tests your doctor might perform. Diabetes prevention. Type 1 and type 1.5 diabetes are not preventable because they are caused by an issue with the immune system. Some causes of type 2 diabetes, such as your genes or age, aren't under your control either. Yet many other diabetes risk factors are manageable. Most diabetes prevention strategies involve making simple adjustments to your diet and fitness routine. If you have received a diagnosis of pre-diabetes, here are a few things you can do to delay or prevent type 2 diabetes. Get at least 150 minutes per week of aerobic exercises like walking or cycling. Cut saturated and trans fats, along with refined carbohydrates, out of your diet. Eat more fruits, vegetables, and whole grains. Eat smaller portions. Try to lose 5% to 7% of your body weight if you have overweight or obesity. These aren't the only ways to prevent diabetes. Discover more strategies that may help you avoid this chronic health condition. Diabetes in pregnancy. People who have never had diabetes can suddenly develop gestational diabetes during pregnancy. Hormones produced by the placenta can make your body more resistant to the effects of insulin. Pregestational diabetes. People can have diabetes before they conceive and carry it with them into pregnancy. This is called pregestational diabetes. Risks to your newborn. Diabetes during pregnancy can lead to complications for your newborn, such as jaundice or breathing problems. If you're diagnosed with pregestational or gestational diabetes, you'll need special monitoring to prevent complications. Does gestational diabetes disappear on its own? Gestational diabetes should go away after you deliver, but it does significantly increase your risk of getting diabetes later. About half of people with gestational diabetes will go on to develop type 2 diabetes. Diabetes in children. Children can get both type 1 and type 2 diabetes. Managing blood sugar is especially important in young people because diabetes can damage important organs such as the heart and kidneys. For type 1 diabetes, the autoimmune form of diabetes often starts in childhood. One of the main symptoms is increased urination. Kids with type 1 diabetes may start wetting the bed after they have been toilet trained. Extreme thirst, fatigue, and hunger are also signs of the condition. It's important that children with type 1 diabetes get treatment right away. The condition can cause high blood sugar, dehydration, and diabetic ketoacidosis, DK, which can be medical emergencies. For type 2 diabetes. Type 1 diabetes used to be called juvenile diabetes because type 2 was so rare in children. Now that more children have overweight or obesity, type 2 diabetes is becoming more common in this age group. Some children living with type 2 diabetes don't experience symptoms. Others may experience increased thirst, frequent urination, extreme fatigue, blurry vision. Type 2 diabetes is often diagnosed based on medical history, a physical exam, and blood work. Untreated type 2 diabetes can cause lifelong complications, including heart disease, kidney disease, and blindness. Healthy eating and exercise can help your child manage their blood sugar and prevent these problems. Type 2 diabetes is more prevalent than ever in young people. Learn how to spot the signs so you can report them to your child's doctor. Controlling diabetes with Indian food. Indian food is famous in the world for its intense and tasty flavors. However, did you know that Indian food is mainly based on the ancient systems of Ayurveda that aims to keep your body healthy and balanced? From preventing diseases to managing them, Indian food has always been effective. Today, although the steep rise in lifestyle conditions such as diabetes and hypertension has increased among the young and old, Indian food holds the key to control diabetes effectively and sustain it. Wondering how to control diabetes with Indian food? Continue watching to learn more. Indian food comprises staples such as rice, chapati or roti, which are carbohydrate-rich and can cause a spike in blood sugar levels. But it is a misconception that Indian food is unhealthy or does not allow you to sustain a healthy lifestyle. Whether you have type 2 diabetes or gestational diabetes, a well-balanced Indian diet plan can help you bring your blood sugar to normal levels. Daily dietary requirements in diabetes. A person with diabetes must include lots of fiber-rich foods, proteins and simple carbohydrates in their diet. Refined and packaged foods cause an increase in glycemic index and must be avoided altogether. It is also essential that an individual with uncontrolled blood sugar levels consume foods that release energy slowly and eliminate toxins. Though there is no one-size-fits-all when it comes to a daily diet plan. Here is what the recommended daily nutrition chart of a person with diabetes should look like. Fat limit to 25% to 30% of daily caloric intake. Carbohydrate not more than 55% of your daily caloric intake. Fiber 30 to 40 gm day. Protein 15% to 20% of daily caloric intake. We recommend Pro360 Diabetic Care Nutritional as a daily drink. Carbohydrates are the food group that provides our body with energy to function. However, consuming an excess of carbs can increase the sugar levels in the blood, which is a characteristic of diabetes. For this reason, other food groups, especially proteins, are vital for diabetes control. According to experts, consuming proteins prevent muscle loss, wasting, in people with diabetes. This muscle wasting further contributes to a rise in blood sugar levels. Indian diet allows an immense scope of including proteins in your diet, in vegans, vegetarians, and non-vegetarians. However, it is essential to remember that consuming excessive proteins or eating a high-protein diet can contribute to a rise in your blood sugar levels. For this reason, 55% of your diet should include fiber-rich carbohydrates, 15% to 20% of this should be protein, and 15% to 20% should consist of fat. Some protein-rich foods that diabetics can include in their diet are as follows. Eggs, milk, yogurt, paneer, lean chicken, lentils, dals, legumes, chickpeas, nuts and seeds, soy and soy products like tofu, fatty fish, seafood, cauliflower, tomato, goods, beans, mushrooms. How to control gestational diabetes with the Indian diet? Gestational diabetes is a condition that occurs in women during pregnancy and is characterized by a rise in blood sugar levels. Indian food can help manage gestational diabetes and reduce risks to the mother and her child. Regardless of your diet type, the key to managing gestational diabetes with an Indian diet is eating a balanced diet that comprises a platter of healthy foods. Here is how to control gestational diabetes with Indian diet. Include lots of fresh fruits and vegetables. Moderate amounts of lean proteins. Moderate quantities of healthy fats and whole grains, cereals, pasta, rice, whole wheat and starchy vegetables. Avoid foods that are sugar-rich, sweetened beverages, bakery foods, and desserts. Women with gestational diabetes must consume small to moderate-sized meals 3 times a day and 1 or 2 snacks. Do not skip meals. Quantity of food groups to consume. Carbohydrates. Less than half the calories you consume during the day must come from carbohydrates. Some sources rich in carbs include bread, rice, wheat, potatoes, fruits, fruit juices, sweetened beverages, and candy. Avoid simple carbohydrates such as potatoes, white rice, and sweets as they cause a spike in blood sugar levels. Legumes and starchy veggies. This food group is important to maintain healthy blood sugar levels. You can safely consume 6 or more servings of grains, beans, and starchy vegetables. Some foods that you can include in your diet plan are whole grain products, such as crackers, crisp biscuits, bread, cereals, beans, oats, wild or red rice, and pasta. Other vegetables. Eating any amount of vegetables can rarely do you any harm. For gestational diabetes, you must consume at least 3 to 5 servings of vegetables a day. Some healthy options include leafy greens, carrots, peppers, and brinjals. Try to consume vegetables as fresh as possible. Fruits. Consume 2 to 4 servings of fresh fruits every day. Some ways to add fruits to your diet include freshly peeled and chopped citrus fruits, grapefruits, oranges, sweet lime and tangerines, and fresh juices without added sugar. Protein. If you are a non-vegetarian, get at least 2 to 3 servings of proteins during the day. Fish and lean poultry meats are healthy and filling. Remove as much fat as possible from meats like veal, beef and pork if you wish to consume them. We recommend Pro360 Diabetic Care Nutrition Supplement. Complete Balanced Diabetic Nutrition to fulfill daily protein needs, especially made to support overall health care for adults with diabetes. Pro360 Diabetic Care is scientifically formulated diabetic protein drink with triple protein formula in rich addition of dietary fiber helps to manage blood sugar spikes and diabetes in a more controlled manner. This protein supplement for diabetes patients contains DHA, an omega-3 fatty acid which lowers the risk of heart disease and provides you an amazing amount of energy without increasing a rise in your blood glucose. Pro360 Diabetic Care Protein Powder gives you a healthy dose of vitamin B12 that helps in diabetic neuropathy and retinopathy treatment. This protein drink for diabetes is the right nutrition for managing blood sugar levels, weight loss, and cholesterol. Formulated with an ideal balance of high-protein nutrition in terms of both macro and micronutrients that are essential to manage diabetes. Pro360 Diabetic Protein Powder boosts energy and stamina to stay active for the whole day. Women with gestational diabetes must limit their consumption of fatty foods such as butter, oils, margarine, and desserts. Replace your refined cooking oil with cold-pressed or healthy oils such as olive oil, canola oil or safflower oil. Best foods to control diabetes. Figuring out and coming up with the best foods to control diabetes would be the top priority of any person newly diagnosed or living with this condition. The main premise of this exercise would be to ensure that the foods do not end up spiking blood sugar levels. Additionally, it would also be important to not consume any foods that would trigger further complications that could arise as a result of diabetes such as heart conditions, cholesterol, etc. Here are some of the best foods that you can consume with diabetes. 1. Leafy greens. These are some of the most nutritious food categories that are low in calories. Since they also have properties like being low in digestive carbs, these are foods that will not affect blood sugar levels significantly. Spinach, kale, methi, fenugreek, etc. are great sources of vitamins and minerals. Since people with diabetes are often known to have lower levels of vitamin C, these vegetables can be great to add to the Indian diet plan for type 2 diabetes. 2. Avocados. Avocados are growing in popularity among the Indian population in today's times. Having less than 1 gram of sugar, very few carbs, and high fiber content, avocados will not elevate blood sugar levels drastically. They are also known to be associated with an improved diet quality overall and can lower body weight and BMI. 3. Eggs. The consumption of eggs regularly can reduce the risk of heart disease as it can help to decrease inflammation, improve insulin sensitivity, and increase the HDL, good cholesterol levels in the body, etc. Eggs can also reduce the risk of stroke. 4. Chia seeds. Chia seeds are wonderfully nutritious for people with diabetes. They are high in fiber and low in digestive carbs. In fact, the consumption of chia seeds is actually known to lower blood sugar levels as it slows down the rate at which food moves through the gut. It can also help you in healthy weight management. This can be added to the list of options for Indian breakfast for diabetes. 5. Beans. Beans are affordable and nutritious and are considered very healthy. They are a type of legume rich in vitamin B, calcium, potassium, magnesium, fibers, etc. Since beans are low in glycemic index, they can help prevent the onset of diabetes and manage the condition. 6. Nuts. The easiest snack present in almost all Indian households would be nuts. They contain fiber and are low in carbs. Research has also favored the consumption of nuts as they can reduce inflammation and lower blood sugar levels. These can also help people with diabetes improve their heart health. 7. Broccoli. One of the most nutritious vegetables, half a cup of cooked broccoli will contain only 27 calories and 3 grams of digestible carbs along with vitamin C and magnesium. It can also help manage blood sugar levels. 8. Strawberries. If you are wondering what fruits you can add to your list of diabetic-friendly foods, consider strawberries as they are rich in antioxidants. They are also known to improve insulin sensitivity. Also read about is pomegranate good for diabetes. 9. Garlic. With only 4 calories in 1 clove of garlic, you can find a good amount of magnesium, vitamin B6, vitamin C, selenium, and fiber. Garlic is known to help with improved blood sugar management and the regulation of cholesterol. 10. Flax seeds. These can be consumed as seeds or as a powder. They improve overall heart health as they are rich in omega-3 fats and fiber and are loaded with other plant compounds. The compound, lignans, can also help reduce the risk of heart disease and improve blood sugar management. Indian breakfast for diabetes. This is considered the most important meal of the day and skipping it is not an option, especially for diabetics. Here are Indian breakfast options to include in your diet plan. Sprouts, considered to be one of the best options in Indian breakfast for diabetes. Sprouts are low in carbs and high in proteins, fiber, folate, vitamin K, magnesium, phosphorus, and beta-carotene. They can help reduce blood glucose levels and improve digestive health. They can also increase good cholesterol levels and reduce bad cholesterol. Red poha, especially with lots of vegetables, can be high in multiple vitamins and minerals. Fiber, vitamin B, iron, calcium, zinc, manganese, magnesium, antioxidants, etc. can help keep you full for a long time. It can also aid in digestion and can help fight anemia. Ragi wheat dosa. Who said people with diabetes cannot eat dosa? When made with ingredients high in fiber, proteins, iron, calcium, carbs, and essential fats, dosa can be one of the best and tastiest foods to consume as breakfast. It can also strengthen the bones and the immune system while assisting with weight loss. Smoothie or fruit bowl. A smoothie with Greek yogurt, chia seeds, nuts, fruits, etc. can be nutrition dense and can keep you full for a long time. The natural sugars in fruits can be consumed in the morning and can be helpful even before your morning workouts. Bread sandwich. A sandwich made out of whole wheat bread loaded with vegetables like tomatoes, onions, lettuce, cucumbers, etc. can be great as an Indian breakfast for diabetes type 2. One sandwich in the morning can help you receive a good amount of fiber and proteins along with vitamins and minerals from the vegetables. Some other breakfast options. Dalia. Vegetable parathas such as peas paratha, mixed veg paratha, gobi paratha, cabbage paratha or paneer capsicum paratha. Vegetable upma. Vegetable oats. Oats with freshly cut fruits and honey. Vegetable or masala omelette. Boiled eggs with vegetable and whole wheat bread sandwich. Minced chicken paratha. Idli. Dosa. Chilla. Poha. Chivda. Drinking a glass of unsweetened milk 1 to 2 times a day is beneficial for people with diabetes. Indian lunch for diabetes. Eating lunch on time every day is vital to maintain normal blood sugar levels. Some foods to include in your lunch are whole wheat rotis 1 to 2. Bajra, jowar or ragi rotis. A big ball of seasonal vegetable. Salad vegetables or sprouts curd-based raithas. 1 portion of meat, lean poultry meats or fish. Dal. A glass of buttermilk to end the meal. Indian dinner for diabetes. Individuals with diabetes must eat their dinner 2 to 3 hours prior to their usual bedtime. Here is what your dinner plan should look like. 1 bowl of leafy green, saag, spinach or methi, chana, soya chunks, fish, chicken curry, vegetable stir-fry or gravy. 2 to 3 rotis, bhakri or paratha of your choice, preferably whole grain or multigrain. Fresh vegetable or sprout salad. Avoid high-carb and starchy foods in your dinner. Indian snacks for diabetes. Whether you are hungry during the day or in the evening, you must eat a healthy snack. Along with diabetes, we often see comorbidity of hypertension and high blood pressure in many people. This is why people with diabetes not only need to follow a diabetic-friendly diet, but also need to ensure that they are eating Indian snacks to control blood pressure as well so that their heart health is not compromised. High blood pressure can be highly dangerous as it can lead to several other complications in the body as well. That, along with diabetes, can often be fatal. Some snacks that can be included in the Indian diet plan for high blood pressure would be bananas. 1 banana in a day can be an excellent source of potassium and can provide carbs and fiber. If you have diabetes, make sure to consume a less ripe banana as it would have lower amounts of carbs in them. Fruit salad, using a combination of different fruits like banana, apple, half a pomegranate, pears, guava, orange, etc. You can cut and mix the fruits in a bowl and have them fresh. It is an ideal snack for people with high blood pressure. Chicken vegetable soup. This soup is healthy and is rich in proteins, vitamins, and minerals. It is also rich in potassium. Use minimal salt in the recipe. Roasted chivda, one of the tastiest dishes, chivda, rice flakes, are rich in iron and provide a good amount of carbs to the body. They can also help increase protein levels in the body. Omelette with veggies, use 1 egg and chop onions, tomatoes, cabbage, etc. Add these vegetables to your omelette to increase the nutritional content of the food. Discard the egg yolk if you have high cholesterol levels. Healthy diet. Consuming a healthy diet is a cornerstone of a healthy lifestyle, irrespective of if you have diabetes. However, people living with diabetes need to understand how certain foods affect the level of blood sugar in our bodies. Not only do they need to know the right diabetes control food to eat, but also the right quantity and the right combination. Here is a rundown of some of the best food for diabetes control and how diabetes can be controlled the best way using the right foods. Counting carbohydrates and controlling portion sizes is the key to proper diabetes control. Carbohydrates impact blood sugar levels in the biggest way. Use a scale or measuring cup to ensure you consume the right portion size to keep the blood sugar in control. Make sure that all your meals are well balanced. Each meal should contain a good mix of vegetables, fruits, starches, fats, and proteins. Choose the right kind of carbohydrates. Certain food categories act as diabetes control foods, such as fruits, whole grains, and vegetables. They have low amounts of carbs and fiber, which help keep blood sugar levels in check. Sugar-laden sweets and beverages cause blood sugar levels to rise rapidly. Due to this, they should be avoided entirely if you have diabetes. Exercise. Being physically active is another essential facet of controlling type 2 diabetes. When we exercise, the muscles produce energy by using up the sugar present in the blood. Exercising regularly also helps the body to use insulin efficiently. As a result, the blood sugar level is lowered. The more you exert, the longer the effect will last. However, light physical activities such as walking, gardening, and housework can also help you control diabetes. Discuss an exercise plan with your doctor. Ask them about the type of exercises that are right for you. Aim for a minimum of 30 minutes of aerobic activity daily. An intense workout can reduce sugar even up to a day later. So make sure to check your levels before and after exercise. If you take insulin and your blood sugar is below 90 mg per deciliter, make sure to eat a snack before you begin exercising to avoid lowering your blood sugar level excessively. Reduce stress. When we feel stressed, our body produces certain hormones that can cause blood sugar levels to rise. You may also find it harder to stick to your diabetes management plan if you are under a lot of stress. If you have been feeling stressed lately, try some relaxation techniques. Avoid the common stress triggers as much as possible. Learn strategies to cope with stress. Working with a clinical social worker or psychologist may also help. Quit smoking. Smoking can be extremely dangerous for people with diabetes as both are known to narrow the blood vessels. This narrowing of the blood vessels puts extra pressure on the heart and causes it to work harder. Quitting smoking will help lower your risk of stroke, heart attack, kidney diseases, nerve diseases, and diabetic eye diseases. It will help improve your blood pressure and cholesterol levels as well. Your blood circulation will be better, and it will be easier for you to exercise as well. If you are in the habit of smoking, stop now. Take help from your doctor or counselor and give up this dangerous habit as soon as possible. Stay hydrated. Dehydrates and diabetes go hand in hand. Dry mouth and excessive thirst, in fact, are both signs of dehydration and indicators of diabetes. When we have diabetes, our body cannot produce and use insulin efficiently. Insulin helps the cells in our body to absorb sugar from the bloodstream and use it to produce energy. When the body is unable to use insulin properly, the excess sugar starts accumulating in the bloodstream. When the blood sugar remains high for a long period, the kidneys have to work extra hard to remove this excess glucose via urination. This can lead to dehydration, especially if you do not replenish the lost fluids. Drinking water will not only keep dehydration at bay but also helps the body remove excess glucose easily. If you have diabetes, drink lots of fluids, at least 2 liters per day, to fight dehydration. Add fresh lemon or lime juice to plain water for extra flavor. You can also drink herbal teas, sugar-free coffee, or skim milk. However, avoid energy drinks, sodas, and fruit juices as they contain a lot of sugar. Best exercises for diabetes. A diabetes meal plan, when paired with healthy lifestyle changes and physical activities, it helps in keeping blood sugar levels stable. A regular exercise routine can regulate your sugar levels along with keeping you fit and make you strong. Exercising is the best diabetes control tip to keep you active along with preventing the risk of diabetes and all the complications related to it. Some of the exercises which you can include in your daily life are as follows. Walking. Walking is an easy exercise to start with. It is enjoyed by most people as it is a low-impact activity. Walking improves glucose levels, blood pressure, and cholesterol levels. 30 minutes of brisk walking is also good for heart health. Cycling. Cycling is great for people with diabetes as helps in maintaining sugar levels. Regular cycling can boost your heart health along with keeping your lungs healthy. It is also helpful in improving your body posture and balance. Dancing. Dancing is a fun activity that is enjoyed by all groups of people. It is an ideal exercise to keep diabetes at bay. It is great for heart health and also improves your fitness. Water aerobics. Water aerobics is an effective way to improve the glucose levels in the body. It is easy on the joints and improves blood circulation. Swimming can boost heart health by stimulating the heartbeat, reducing blood pressure, and strengthening the heart muscles. Yoga. Yoga is beneficial as it improves the strength, flexibility, and balance in a person. It is a low-impact movement that involves meditation and breathing. This is great for older people and helpful in controlling blood sugar and cholesterol levels. Bottom line. Blood sugar levels can be successfully managed in many ways. Making lifestyle changes, consuming diabetes control food in moderation, keeping your weight in check, improving sleep quality, managing stress, staying active, and staying hydrated are some of the easiest yet best ways to improve your quality of life when living with diabetes. Consult your healthcare provider to make a tailored plan for managing diabetes and knowing the best food for diabetes control.